Welcome everyone to the Wealth of Health podcast. My name is Ahmed, and with me as always is Dr. Paul Jenkins, consultant physician and endocrinologist.
Welcome.
Today's topic is sleep. Paul, sleep is the one thing that every single person on the planet does every single day, and yet so many people now are suffering from insomnia, disrupted sleep patterns, or at least 2 or 3 days a week, they just do not get a good night's sleep. So we're going to talk a little bit about this today. What causes that, or the potential number of triggers for that. Also, what can people do from a natural remedy perspective to improve their sleep? And then we'll delve deeper with our second guest on this podcast. But to start with, why do human beings need sleep?
Well, I suppose there's a need for sleep. We spend a quarter to a third of our life asleep. So it's a big chunk of time.
Seems like a waste.
Well, some of us say so, but as you get, you recognize the importance of sleep more and more. From a scientific point of view, it's thought during sleep, we now know the brain rests. There is a circulation of the fluid, the cerebrospinal fluid, which covers the brain, and slow clearance of waste products. So it's a sort of cleansing during sleep. It allows the so-called brain plasticity, the brain to adapt and to function better after it's had a certain amount of sleep. We know if you don't get enough sleep, you suffer with low mood, can affect that. Seizures, it can contribute to blood pressure, headaches, migraines. I mean, I know I get migraines. If I have low sleep, it's a big risk factor.
Right.
And then if I then try and counter that with too much caffeine, I'm on very short thrift for getting a migraine. So you need it to, it helps prevent that. So all in all, we know that, good night's sleep or consistent sleep is also important, reducing the risk of dementia, cognitive decline, perhaps related to all of this clearance of waste products.
Yes. Okay. So it's the IT equivalent of a reboot of the system.
Yeah. Yes. And the other analogy I have is the equivalent of just plugging your phone in and charging the batteries.
Right.
If you don't get a good night's sleep and charge your batteries, you're going to start the day, half charged.
Depleted already.
Yeah.
And are there different types of sleep?
Yeah, the two main types of sleep is what we call REM, which is rapid eye movement, and non-REM sleep. And then we cycle between the two. And usually we have 4 to 5 cycles of those during a night. So the non-REM is the 4 stages of that. When we start just falling asleep, you go into that slight in-between stage.
Yes.
Then you become more deeply asleep and your body temperature starts to cool, the breathing rate slows down, and then you go into so-called deep sleep. Stages 3 and 4, deep sleep. And that's thought nowadays to be the most restorative sleep when these functions happen of the clearing. And then you have rapid eye movement sleep. You cycle through as it says, your eyes movement, your breath rate increases, and and you become sort of paralyzed during those periods of sleep. You can't move, and then you cycle through the non-REM again. So,
okay, and it depends on the person. I mean, it's completely almost subjective. I know it's not, but it feels like some people want more sleep, some people sleep for less time and they're fine the following day. So is there something that regulates that sleep in the body?
Yeah, there are two things. I mean, there is an inherent rhythm to our sleep, which affects many of the body's what we call homeostasis, which is the natural balance of the sleep, and that's often related to the light-dark cycle. So it's a circadian rhythm. So our bodies has an inbuilt clock regulate to the pineal gland in the brain and production of hormones which tell us when it's time to fall asleep, and then conversely when it's time to wake up. So that tends to be pretty fixed for most people during the day, and it's one of the causes of the jet lag. When your time clock is out of sync with the biological clock. and vice versa. And then we have overriding that is just a general sleep drive. You know, we know if we haven't had any sleep, you want it more, more, more. And sleep deprivation, then eventually, regardless of the time of day, you have to fall asleep. Yeah. So those are probably the two main drivers.
All right, and I know our section in the beginning is that we're not going to delve deeper because we have two expert people to talk to today. But from your perspective, what are your top tips to improving sleep?
Okay. Well, I mean, I think you started that, and very commonly, many of us feel sleep deprived at times. You know, we're not getting enough sleep, or we don't sleep as well as we can in our busy lives nowadays, increasingly frenetic. That can often contribute. So I think that the top tips are good sleep hygiene. So what I mean by that is preparing yourself for sleep properly. So not having the stimulus of your screens, you know, just right up to bedtime. Yes, because that is keeping you alert. Is making sure that the bedroom is cool. Cool temperature helps sleep. Putting good curtains on, so you're not subject, certainly in the early morning, to the sunlight coming in, because that's going to wake you. And then the common avoidance to take is the most important is caffeine. Yes, and it's amazing how many people have caffeine throughout the day. You shouldn't really have caffeine after lunchtime or afternoon. Caffeine coffee has a half-life of 6 to 8 hours. So if you have a double espresso, you know, at 12 o'clock noon, then that's still going to be significant amount of caffeine in your body 12 hours later. So that can certainly contribute to sleep. So if you're having coffee in the afternoon or evening or after dinner, you should certainly stop that. Be careful that tea has a very high caffeine content, including green tea. So avoid the caffeine. And then the common other factor which can certainly lead to disturbed sleep is alcohol. So alcohol puts you to sleep, but then you tend to wake up and in a slightly disturbed, lighter sleep throughout the night.
A lot of people are not going to like what you're saying, Dr. Jenkins, because people will hit 3 p.m. or 4 p.m. and they're like, I feel sleepy and tired. I'm just going to have a small espresso. Or if they're out for dinner, they will finish the meal with an espresso or coffee of sorts. Also, alcohol, everyone's going to have a glass of wine during alcohol. So what we're saying, I guess, really is that it's not one big thing that affects all of our sleep. It's all the little things that we do habitually throughout the day.
Correct. And also, I mean, as always, we're all individuals. We don't all respond exactly the same. So some people can drink caffeine throughout the day. It really doesn't seem to affect them.
I'm one of those people. I can have an espresso right before bed and fall asleep normally.
Yeah, because coffee, one thing I might counter that is coffee doesn't work immediately. So if you're having it just before bed, fine, you fall asleep, but it can then cause you to wake up or have more disturbed sleep, you know, 4 or 5 hours later.
Okay.
So, but yes, we're all different, and it depends. If you have disturbed sleep and it's affecting you, then and you want to improve your sleep, then I think you've got to look at the potential factors which might be adversely impacting on your sleep.
And that's really the key. If you're getting slightly disrupted sleep, but you're fine, it's not impacting your life, great, have your coffees and your glass of wine and all that. But if it starts to put you in a bad mood every single day and it's getting in your way of, just having a full working day, for example, with a consistent level of energy, then maybe consider one of those factors.
So exactly, see what factors you can do. But I think, that's me from my sort of general perspective. We should now speak to some of the experts.
On this episode, our first guest is Malminder Gill. Malminder is a renowned hypnotherapist, and she's also the founder of the Sleep Concierge. And she will be talking to us more about the lifestyle changes that we can make to improve our sleep. Here's what she had to say. It is our pleasure to have Malminder Gill with us. Malminder, you're a globally recognized, award-winning sleep expert. You helped thousands of people improve their sleep. You're highly respected and trusted by our clients, who include celebrities and royal families from around the world. You also developed the Sleep Concierge, which is a sleep therapy program created for hotels and wellness centers to help increase their guests' quality of sleep. So you have a lot of time, you have a lot of free time on your hand then.
Yes, a lot of free time.
It is an absolute pleasure to have you with us. Sleep concierge sounds fascinating. Can you tell us a little bit
Yes,
about
yes.
it?
Well, first of all, thank you for having me on this podcast. And well, with the Sleep Concierge, it's a program designed for guests staying at hotels or patients in rehab centres to help facilitate sleep. So it's a little bit more advanced than meditation because I use therapeutic techniques in the audio recordings that I supply these properties. So the idea is pretty much you check in as a guest or a patient, and you're either on holiday or you're there for rehab. And at the end of your day, when you go to bed, you listen to my audio, and within that audio, I will go through lots of different metaphors and storytelling, but also some key therapeutic processes designed to help clear the mind, relax the body, so that you can fall asleep. That's pretty much the sleep concierge.
That sounds fantastic. Is that something that people can replicate to a certain extent at home?
They can, to a certain extent. So the audio is available at these properties. Guests and patients can obviously access those when they're at home as well. But in the nuts and bolts of it, when we're looking at the actual audio program, it contains uh, set processes to help clear the mind. So that's the piece that you can repeat over and over again. If there's something in your mind that's bothering you, perhaps even during the day, you can use it, but it's particularly useful at night. So I go through, I think in the recordings, 4 different processes tackling thought clearance, let's say, or thought disturbance in different ways. Some people are a little bit more um, disturbed by just the general clutter, just thinking of random, meaningless things, and so that sort of takes hold. Or if there's something significant going on in one's life and they're struggling to fall asleep, like a divorce, perhaps, or grieving, that's a particular challenge, and so there's certain things you can do for that. So what I'm doing in the audio program is a little bit of the key things that I know tend to work in general for people.
And is that accompanied by anything else, a certain setup maybe in the room, or does it impact the food they eat or what they
Yes,
drink?
absolutely. So you're 2 steps ahead of me now. So, although the bulk of the program is the audio program, I also advise properties on um, evening menus, the kind of foods to eat and the ingredients to put together for an evening meal that will encourage a better night's sleep. Also, um, sleep mocktails, sleep hot chocolate. Um, I also provide a morning meditation because my motto is a good night's sleep starts in the morning. To reset the circadian rhythm, to get the natural light into your eyes early on, as early as possible. So there is a little sequence that just a little template that sits on the bedside, which goes a little bit beyond uh, the general tips that you find out there.
Can I ask, Malminder, what sort of foods would you generally say to avoid? What are the 3 worst foods to have that would
A
keep you
heavy
awake?
carby meal. So a plate full of
Okay.
pasta, probably not a good idea. Um, Anything sugary, not a good idea. Lots of alcohol, not a good idea. So in a sense, it's using common sense as well. But there are certain foods in particular that might be helpful for inducing relaxation and therefore sleep. Turkey, for instance, is high in tryptophan, and as we know, that helps trigger sleep. Enjoying your evening meal or your hot drink at night with a little bit of saffron is likely to help you fall asleep as well. So there's lots and lots of different things out there, but the main thing is to keep the glucose levels steady. And certain foods do that, other foods don't. So uh, slightly heavier on the protein side, but not too much, because then that kickstart a heavy digestive process in the body. You want to avoid that. So it is quite balanced, but a light meal. In essence, is a light meal.
Okay, and not just before going to bed?
No, so I would say if you can, 3 or 4 hours before bed, so
Okay.
that your body can go through the whole digestive process, and your any glucose spikes can be had in that in that window, so that you can
Okay.
enjoy steady glucose for sleep.
With the turkey, is that why I fall asleep after my Christmas lunch? Or is
Probably.
it the red wine that I've had with the turkey?
Well, the wine probably helps you to fall asleep quite quickly, but it might wake you up.
And then I wake up again, yes.
Yeah, then you need a
Okay.
turkey sandwich to go back to sleep
Yes,
again.
to go back down. So it's overindulgence over Christmas is going to be the trick. Okay.
What about drinking? What should people avoid? Well, you kind of mentioned alcohol, but what should people drink actually to help them um, fall asleep?
Well, so it depends how experimental you want to be. S- I I would say, if you can find hot chocolate that contains magnesium biglycinate, magnesium threonate, that will be helpful. Sprinkle in some ground saffron, that would be good. Dark cacao, drink dark cacao hot chocolate would be also good. Something that doesn't have any sugar. So they're the warm drinks, but also you can make your own mocktail and buy separate ingredients. Sprinkle in a bit of lemon balm, a little bit of magnesium, and just make your own. I do that here all the time at home. Make my own little cocktail of different liquid supplements that you can put together like a little stack, and enjoy that. There was something going around on TikTok around a few months ago, tart cherry juice mixed with magnesium. That was very, very popular on TikTok a few months ago. So of course I had to try it. It it didn't really work for me, but it does work for
Fair
lots
enough.
of other people. Lots of other people. So that's a quick one that apparently a lot of people swear by. But magnesium is the thing that I would say you want to be putting in your drinks. Stay away from sugar, stay away from caffeine, and even fake sugars like sweeteners. That sometimes still has an effect on the body that can keep you awake. I would say plain water, really, maybe with a bit of lemon.
So, in your experience, Malminder, with all of that, do you think are the commonest issues that affect clients? When you go and you're called around the world to see people who have significant sleep issues, there must be, like in many of us, our fields, some certain common themes that you have to address. And what would be your most common ones?
Absolutely, yes. The first one is not being able to fall asleep. The second one, falling asleep okay, but waking up in the middle of the night and then not being able to fall asleep. The third one being falling asleep okay, not really waking up in the middle of the night, but waking up at 4 a.m. and then waking up too early. They're the three categories. And of course, uh, when I speak to a client, I always think, well, something, depending on what they say. So if the issue is I can't fall asleep because of a racing mind, that's something I can really help with. If it's an issue of I'm waking up too early, it might be psychological, but it might be a glucose issue where there's a sudden cliff drop in glucose and adrenaline cortisol is firing up too early. Then I refer that client out. That's more likely something else. And then the tricky one is the person that wakes up in the middle of the night, because that client tends to not want to hear that they need to change their evening routine, because that's probably the bit that is disrupting. If you're drinking a glass of wine, enjoying a heavy meal, you might fall asleep very quick, but you'll probably wake up in the middle of the night. So it's the first category I tend to help with, which is struggling to fall asleep in the first place because of a racing mind.
And just a last one, but you mentioned that it's important to get the daylight in early.
Yes.
Yeah. Does that mean you should or you shouldn't use blackout curtains?
Oh, it depends. It depends, I guess, on the season as well, right? So at the height of summer, you might want those blackout curtains.
Okay.
But no, that's a great question. Blackout curtains, it will just help with your quality of sleep through the night. But if you're waking up at, let's say, 7 a.m. and you can enjoy your cup of coffee or tea in the garden or on the terrace or on the balcony, then do. And try and do that within 20 minutes of waking up, without glasses, without contact lenses, and certainly without sunglasses, just to get the natural light into the eyes.
Thank you so much, Malminder, for that really interesting insights into what we should do and what we should avoid. And if listeners do want to learn more, we'll put a link to your website on our description. So thank you once again.
Thank you, Paul. Thank you, Ahmed. It was thank you
Thank
for
you.
having me.
A pleasure. Thank you.
Well, that was really interesting and some very helpful hints as to the importance and how to improve our sleep. I think it'd be very interesting to get some more clinical insights into this and perhaps delve into some of the science behind it. So for this, we asked Dr. Zoe Gotts, who's consultant clinical psychologist at the London Sleep Centre, for her input and views on this area. We're delighted to have a further speaker with us tonight, Dr. Zoe Gotts. Dr. Gotts obtained her MSc in sleep research in 2009 and 2014, and then completed a PhD in sleep psychology, specifically on the role of sleep in chronic fatigue syndrome. She was the Associate Director of the Northumbria Centre for Sleep Research from 2014 to 15, and subsequently undertook training in clinical psychology, obtaining her doctorate in clinical psychology in 2019 from Newcastle University. Dr. Gotts, we're delighted to have you with us to join us tonight.
Thank you so much for having me. It's a pleasure to be with you.
Well, look, can I just start maybe the first question? And can I ask, from a psychological perspective, what do you think are the key features influencing sleep?
I think from a psychological perspective, people tend to come to us with a lot of different psychological issues that affect how well they're sleeping. And the main ones tend to be anxiety. And that might be anxiety around day-to-day life, pressures, financial stress, relationships, mental or physical health issues. That really impacts sleep a lot. And the reason why that impacts sleep is because anxiety is very much linked to stress hormone cortisol, adrenaline, and when they're high levels in the body, it's really, really difficult to sleep well. So we need to make sure we're regulated from a psychological and physical point of view. The other psychological issues that affect people's sleep are how much worry they come to the clinic with. So are they naturally a worrier? But also typical mental health issues that you would see in patients day to day. So everybody is on a continuum when it comes to mood or mood difficulties. Somebody with low mood or manic mood will definitely have sleep problems. Okay. So we need to look at people in terms of how regulated they are, in terms of their mood, and in terms of their levels of anxiety. Now, there are all sorts of other conditions, psychological conditions that do affect sleep, but that would be a whole other podcast.
I think the cortisol issue is fascinating because, I'm an endocrinologist, and
Yes.
so very aware of the sort of clearly circadian rhythm of cortisol. And as we go to sleep, your cortisol levels should be undetectable. And
Absolutely.
the
Such a
levels rise.
huge influence. And also when we're waking up in the morning, naturally there's that increase in cortisol, that cortisol awakening response that everybody has naturally. It's a natural rouse to waking up. And that's why often people struggle between 2 and 4 a.m. with awakenings and think there's something wrong with them, because that's the natural window of time where the body's starting to wake. But if
Yes.
somebody's a little bit more stressed than usual, then they're more likely to wake up more often.
Okay. And another of my particular interests that I've seen, slightly related to endocrinology is the chronic fatigue. And I see a lot of patients who come to me worrying, either it's their cortisol or it's their thyroid gland causing the fatigue and disturbances of it. And interesting, I've found that sleep is absolutely critical to that. And if the first thing is one way or t'other is to enable, my patients to get a good night's sleep. And my simple analogy is, if you're not plugging your phone in, you're not going to recharge your batteries.
Definitely. And it's so bi-directional in any autoimmune condition. When cortisol is involved, if you're not sleeping well, it's going to have a detrimental effect on managing that condition, fatigue, energy levels, and vice versa. If you're coming to approach your sleep and you've already got an existing autoimmune condition or chronic fatigue or fibromyalgia, you are going to have a really difficult time trying to sleep. So it all feeds into that vicious cycle.
And how do you break that cycle if you're in it? So I guess from a wider perspective, what will be your top tips for a good night's sleep? And more specifically, if someone is constantly in that spiral, they can't sleep, so they're stressed, and because they're stressed, they can't sleep. What can they do to break that cycle?
Okay, the first thing is people are often doing way too much to try and sleep better. The paradox in sleep hygiene is people are putting too much effort and work into trying to perfect the sleep. Yeah. And the important thing when it comes to sleep is trying not to overthink it, trying to remove the attention and not focus on it too much. It's meant to be an unconscious process. And as soon as we start overthinking it, it becomes very much at the forefront of our attention. So it's impossible to switch off and make it an unconscious process once we start overthinking it. The difficulty is when people have already got a sleep problem, and often people have had one for more than 6 years before they even seek treatment. So there's the problem in itself. They're already anxious and stressed about sleep. So the work we do in treatment is about detaching that worry and anxiety from the sleep problem. Now, if we're thinking about this from a top tips point of view, and people who aren't at that point of seeking treatment yet, but just looking at the sleep from what can I do to make it better, go back to basics. Go back to before technology and everything came around to make us overthink it and monitor it unhelpful. Bedroom needs to be a good environment, cool, dark, and quiet. That's the basics. That's what we need. Clocks out of the bedroom. Don't check the time. Listen to the body. Are you tired enough to go to bed yet? If not, don't go to bed. Time doesn't dictate what time you go to bed. Go to bed when you're tired. The only thing I would say you need to be rigid about is waking up at the same time every day. That is vital for resetting your sleep homeostat every single day. So if we vary the time we wake up, we vary how much adenosine we're producing every day. And adenosine is hugely influential on how tired we feel when it comes to bedtime. So first top tip, listen to your body on how tired you feel in the evening. Second tip, get up at the same time every day. Third, bedroom environment, cool, dark and quiet. Another tip would be make sure you've got enough wind down from the day. Our lives are very busy. We're highly stressed, got a lot going on. And if you don't break away from that daytime with sufficient time to wind down for bed, you're going to be going to bed wired. So often I tell people to set aside a little bit of time in the evening to put the day to bed, write down a list of things potentially that you've achieved that day, anything that's still on your mind, maybe a to-do list for the day after, anything that might drown your brain as soon as your head hits the pillow. Because as soon as you have quiet time and the brain has space and time to think, it's gonna switch you on and cause arousal in the brain and prevent you sleeping. So that's a cognitive task that I would recommend to everyone. Put the day to bed, then do your wind down in the evening. About 90 minutes is a good amount of time without doing too much. So not having a rigid process of I must do, essential oils, I must have a temperature of that degrees for my shower. People overthink it, and it just needs to be basic, structured, winding down, relaxation. Yeah.
I've always been a little bit fascinated with people who can sleep very little hours, 5 hours, 6 hours, and they've been doing so for the last 15 years. And yet they have almost full energy when they wake up. I know the recommendation is between 7 to 8 hours. How rigid is that recommendation? And are people different? Can some people have just much less sleep and basically it doesn't cause any problems for them?
The recommendation is arbitrary. It's like drink 8 glasses of water, right? And it goes on the national average of what people generally report that they get. So they say between 7 and 9 hours for an adult, up to 12 for a child or teenager. But we will fall somewhere in the middle of that range, depending on our genetics, depending on our age, depending on what physical or mental health issues we have. And that will vary over our life course as well. So if our sleep need is 6 hours when we're 25, it might reduce by half an hour by the time we're in our late adulthood, but not by much. Everybody needs a different amount. It's like shoe size. We're all different. And 5 hours might be perfect for somebody to then function through the day. And that's why you see these people who are functioning brilliantly and they've got the energy and they're focused on 5 hours. If that same person had 8 hours sleep, they might feel terrible because it's outside of their sleep need for them. On the other hand, if somebody needs 8 hours, but they're only getting 5, they're going to feel awful. So it's about finding out what works for each person. And we can find that number out by doing some experiments with our sleep. And that's what we do in the clinic. We take people back to a minimum amount of restricted sleep to sort out all of the difficulties they're having, the awakenings, the continuity problems. We get the pressure up, that sleep homeostat I mentioned, we increase sleep depth. And then once we've got that sorted and they've got a good pattern in place, we increase it back out and find what their sleep need is.
So are these
Fantastic.
the formal sleep studies that you undergo, or these don't require you to be admitted and have too much being wired up?
No, you don't need a sleep study unless there's a suspected sleep disorder that is not insomnia. So insomnia alone can be treated with the gold standard CBTI, which is what my work is involved in doing. If there's any respiratory issues, restless leg concerns, or REM behavior disorder problems, then we would advise sleep study. Now that can be a home sleep study for the respiratory checks, or it can be a full polysomnography in the hospital.
Okay.
Yeah.
Do you find that the sleep apps are any good? people who monitor their sleep religiously and say, "Well, I've had X hours of REM, non-REM, or deep sleep," or
a lot of people come and give me the sleep data and say, look at that, look at what my watch is saying, look at what my ring is saying, and what do you think? And I say, take it with a pinch of salt. It's not medical grade. It's helpful to give you a estimate on timings. It is not accurate, and the research is yet to be looked at in terms of how it can predict our sleep staging and sleep architecture. It's really difficult when patients come and say, but I'm only getting 20 minutes REM, but my friend's getting 2 hours.
So they
It
start to
causes more
compete.
stress. It causes more stress and more anxiety. And the amount of people I see who, after a few sessions, come back and say, you know what, I'm not wearing that ring anymore, I'm not wearing that watch, and actually I feel much better, I'm getting better sleep.
interesting.
Yeah. We have in the clinic, we give out Acti watches, and that's probably even a little bit better than the devices that are available that offer sleep monitoring. And even the Acti watch will give you a measurement of whether you're lying down or upright, and that's what we take as an indicator of, is somebody resting, is somebody alert and awake. And that would be a corroboration of a sleep diary, so that's not even an in-depth investigation of the sleep parameters that you would get from a polysomnograph.
Okay, my last or another point, endless loads of questions that keep coming at me. But, what about, the role of napping during the day? Because British, we hate napping. My patients seem to look at me aghast when I say, well, have a nap after lunch if you want it, like the Mediterranean, and say, no, I've got to keep going. I can't possibly have a nap. Whereas I adore a short 5-10 minute nap after lunch.
How do you manage 10 minutes?
I can just, very lucky, I can just go for 2, 3, 4 minutes and be awake again.
Yeah, we're definitely a nation of sleeping is not achieving.
Yes,
right?
that's exactly
and
it.
it
Yes.
completely fuels that pushing drive mentality, which again, that's a whole other podcast on being self-compassionate and giving yourself the time to self-soothe and getting yourself out of the threat system, which often fuels sleep problems. I think napping is okay if you haven't got a sleep problem. Okay, so when people have gone through treatment with me and have got a good, stable sleep pattern going again, and they're feeling confident in their own sleep, then yeah, fine. If they need to nap, they can nap. It's where you put that nap and for how long. So if you're feeling really exhausted, have 30 minutes, but early on in the day so it's not eating into your sleep drive for that evening. The other thing I would say is certain people, depending on physical or mental health conditions, might benefit from a nap, even during treatment for sleep problems. But it's very individual and it depends on that person. So, for example, we mentioned chronic fatigue. If I have a patient who has insomnia and comorbid chronic fatigue, I might suggest they have a restricted time in bed through the nighttime, but then they schedule in a couple of short naps through the day to manage their energy. That way, they're protecting the nighttime window of sleep, getting that into a good pattern day after day after day, but they've got a management pacing of their sort of dips in the daytime fatigue and drowsiness. Yeah.
Fantastic. Well, this has been very, very informative and very helpful, I'm sure. And thank you for all your advice about having a good night's sleep. I might try a couple of them tonight, actually. So thank you very much, Dr. Gotts. It's been a pleasure, and I'm sure we'll see you again. Thank you.
My pleasure. Thank you for having me.
Thank you.
Okay, so I think we've heard from yourself, Paul, and from Dr. Zoe, and from Malminder as well, and hopefully everyone just got enough advice, practical advice, to take back to their daily life, implement it, and hopefully get a better night's sleep. So on that note, this is all we have time for on this episode. If you liked the topic of today, and if you like the channel, please like and subscribe. And do not forget to ring the ding dong. We will see you on the next one. It is goodbye from me.
And goodbye from me.